All right, I'll go ahead and get started. We'll see if more people start joining up here in a little bit. So, hello everybody. My name is Brooke. I'm the nurse practitioner and owner of Port St. Lucie Medical Wellness. We are a medical wellness spa in Port St. Lucie, Florida. Our number, if you need to contact us, is 772-207-0080. And we are located just off of Southwest Port St. Lucie Boulevard, between Gatlin and the Turnpike. So feel free to come on in and take a tour of the place. We'll be happy to give it to you. Otherwise, we'll get started with the live. Usually I do a live on Mondays. I wasn't here last Monday. I did take a little bit of a vacation, so that was nice. So I apologize for not being here last Monday. But usually on Mondays, I do a live at 7:30 and kind of cover a brief topic or some of the specials that we're offering at the clinic and answer any questions you guys have. So, real quick, we'll go over April's current specials. So we have a couple that are applicable for the kids who are heading off to prom this month and next month. We have a Hydroderm abrasion, which is a mechanical exfoliation that's done with water. So it infuses the skin with a lot of hydration, but it also exfoliates the dead skin and sucks out like any little blackheads and stuff like that that you have. So we have the Hydroderm abrasion combined with the BioRepeel. The BioRepeel is going to help with any hyperpigmentation, fine lines, and wrinkles. It is one of the peels that is not photosensitive, meaning that you don't need to avoid the sun like you do with some of the other peels. Some of the other peels, you got to avoid the sun 2 weeks before and 2 weeks after. This one's not photosensitive, so that's not as important with this one. So regularly those two combined together are $300, and we're offering that for $200. It's a great thing to do before prom, before you get your makeup done. It helps the makeup lay really nicely and make the skin look really glowy. The other one for prom we're offering is Dermaplane. This one we're kind of gearing more towards men or young men who are going to prom. So this is the one where we use like an actual scalpel and we do a mechanical exfoliation of the skin to get all that dead surface skin and skin cells off, to help with new cell production. So usually that's $120, and now for the April special, we're doing that for $89. So you don't just have to be a kid going to prom to take advantage of those. And if you would like to take advantage of those, but you're not yet ready for one of those, you can always call and book your appointment or prepay for it. And that way you can kind of secure that deal. The other one we're doing, which is in office, so we purchase with any Alastin skincare purchase. So we carry the product line Alastin. It's named Alastin because it helps with the elasticity of the skin. With any purchase of one of those products, you'll be entered to win in a raffle for 20 units of Xeomin. So that's a neurotoxin comparable to Botox, plus a BioRepeel. So that's about a $400 package. So pop on in and purchase your Alastin product, and we will enter you guys into that raffle. The other thing we're doing in preparation for summer is the weight loss packages. So we offer semaglutide and tirzepatide. The semaglutide for the special is $200 a month, so it'd be $400 for 2 months. We would honor that special, and it's usually would be $500. And then the tirzepatide for 2 months is $800, and it usually would be $900. So a little bit of savings with that. I do go into a little bit more detail, and I'm kind of a little bit more controlled with the medication when I give it to somebody. A lot of offices just give you the medication and they never talk to you again. I prefer to see you on a monthly basis. The medication has the potential to make you very sick. So I prefer to have a little bit more control over that and touch base with you a little bit more often to see how you're doing, make sure you're feeling okay, make sure the side effects aren't terrible. And then every month we do what's called an in-body assessment. So it's a scale that will analyze your total body, and it will tell us how much muscle mass you have in pounds, how much body fat you have in pounds, and also your percent body fat. So those are important because I don't want you to lose too much muscle. So you may be losing weight, but is it the right kind of weight? We don't want to be skinny fat. We just want to be thin and fit. So that helps me to kind of keep an eye on how much muscle mass you're losing, if you are losing any muscle mass, and then we start having a discussion about taking in more protein, incorporating weightlifting into your workout routines, that kind of stuff. So again, it's a little bit more monitored than some of the other ones. Some of the other ones just give you the vial. You have to draw it up on your own. I pre-draw the syringes for you in the correct doses and label them 1 through 4 for the whole month. And then that way I know exactly how much you're taking every week. And it's just a little bit more controlled that way. And it helps me sleep better at night to know that you guys are a little bit more safe with that medication. Because, like I said, it can make you very, very sick. Let's see. What else are we offering? I'll go over the VIP. So we have a monthly VIP package. It's $129 a month. And what it does is we kind of tailor it to your needs. So say you're interested in doing a biorepeal every month. So that's usually a $150 service. So if you're doing the membership for $129 a month and you plan on doing that biorepeal every month, you can go ahead and purchase that membership, and that can be your item that you get for free every month. So you're saving 20 bucks every month. And on top of that, you will get 15% off any other services and products that you purchase with us. The Botox and fillers will be at a discounted rate as well, so you'll save money in the long run with that. Say you're more interested in doing an IPL photofacial for hyperpigmentation or little broken capillaries and stuff on the face, then that can be your free monthly service. And that is usually a $300 service, so you'd be getting that for $129 instead. So that's a big savings with that one. You can also do a IV. So we offer a bunch of different IVs with a bunch of different vitamins and minerals and peptides. So if that's something you're interested in doing every month, then that can be your free service every month. So we kind of just tailor it to what you're interested in and what your goals are as far as your skincare or your health and wellness. So that's that program. Just to remind everybody, we do offer bioidentical hormone replacement as well as hormone replacement therapy that will require us to do some labs initially to start off with to see where we need to go based upon your levels of testosterone, progesterone, estradiol, all that stuff. But we do offer that, and you can do either the pellets, the creams, the oral medications, or the injections. We have access to all of that. I order it through a pharmacy and it gets sent straight to your house. And then again, I closely monitor that as well. So every couple months I have you come in and we do follow-up labs and make sure everything's on track, make sure you're feeling well, and then adjust the medications as needed. We also offer peptide therapies, and this has become a bigger one as of late. So some of the peptides we offer, there's numerous ones, but there's several that will stimulate growth hormone. So instead of giving yourself like exogenous hormones like testosterone injections or testosterone cream, I can give you a peptide that will help your body produce its own testosterone naturally by stimulating the pituitary gland to release more growth hormone. So you're not interrupting your natural cycle of hormones by throwing in exogenous testosterone. We're kind of just stimulating more of what your body is releasing. So there's several peptides that do that. A awesome side effect of a lot of those is that it helps you sleep at night. Growth hormones are mainly produced when we sleep at night. So as we enter that REM sleep is when our bodies recover and release those growth hormones. So it just naturally makes you a little sleepy, and helps with sleep on top of getting the growth hormones, which will help you maintain muscle mass and lose fat. Um, there are other peptides that help with like aches and pains, so any joint pains, muscle aches and pains, or injuries. There are a couple peptides for that. There's peptides for neuroprotective health. So if you're somebody who has Parkinson's or Alzheimer's or MS, those kinds of things that run in your family, there's peptides that can be taken to help um, kind of prevent those. Peptides are all considered investigational and research medications, so none of them are covered by insurance, none of them are covered through the FDA. That is just something that you have to kind of take your own health into your own hands, and um, with me, I can help you research which ones would be appropriate for you based upon what's going on with you. Um, let's see. Am I missing anything, babe? He doesn't know. Oh, PRP treatments. So I do offer PRP treatments. I say PRP, but so it's platelet rich plasma. That's where I draw your blood and I extract the plasma from it. Okay. And I can use that for various things. It's basically kind of like a stem cell that your own body produces. So whenever I inject it into a certain area, it helps that area reproduce those kinds of cells. So say you've got a shoulder injury, like a partial tear in the rotator cuff or something like that. Um, I can inject that with PRP, and that is going to help those partial tears heal. The full tears or the full thickness tears of things is not going to help with. It will help with inflammation and some of the pain, but it's not going to help heal like it does with the partial tears, or any kind of muscle tear or tendon tear. I can inject with PRP, and that's just going to decrease the inflammation and help stimulate your immune system to repair those tissues. I can also use it for hair restoration. So that's a series of 3 treatments. We do 1 treatment once a month for 3 months, and then you kind of just let it do its thing. The PRP is going to stimulate um, the hormones that are needed to make more hair and hold on to more hair. That's going to work for upwards of 18 months. So that's something that is kind of slow to happen. So a lot of people, they want PRP like for under the eyes or for cheek enhancement. I can turn it into filler and utilize it for those kinds of things. But it is something that takes a little more time. So if you've got the patience, it's a much more natural way to get the looks that you're looking for without looking weird with too much filler or anything like that. Like a bioregenerative kind of intervention as opposed to synthetic fillers. The other one I carry is Sculptra. Sculptra is another bioregenerative kind of medication. It helps your body to produce its own collagen. That one's really good for the cheeks, the temples, right along this tissue right here that kind of gets some laxity in here. How mostly women get like this divot right here from just as we age, we have bone loss. So we get a little divot right here, which accentuates the pre-jowl. So we put it there. I put it right along the jawline, and it's really pretty because it's your own body's making of its own collagen. So it's not going to make too much collagen in one area where you look like the cat lady or look like something weird. Um, so Haley is asking differences between Botox and Dysport for masseter reduction. So overall, grand scheme of things, no difference between the two. You're going to get the same effect with either one of those. The difference would be the time in which either one takes effect and the cost of each one. So Botox takes about 10 to 14 days to kick in, whereas Dysport takes about 2 to 5 days to kick in. So there's a little bit of a time difference there. Botox is $11 per unit. Dysport is $5 per unit. And the reason why there's such a big price difference is because I've got to use 2 to 2.5 times more Dysport, more units of Dysport to get the same effect as 1 unit of Botox. That doesn't mean it's a larger volume of medication that I'm injecting. It's actually a smaller volume of medication. It's just the way that they're both manufactured. It just takes 2 to 2.5 times more Dysport for 1 unit of Botox. So, for instance, if somebody had like bruxism where they clench their teeth at night or clench their teeth during the day, you can use it in the masseters to relax that and help with headaches a lot of the time. Botox, I would probably use about 15 units to treat the masseter, whereas Dysport, I would use more like 30 units to treat the masseter. So once you keep doing that, so over the course of probably your second treatment is when you're going to notice the facial slimming. So a lot of people are doing it in the masseters, not only because they clench their teeth or they grind their teeth or they have TMJ, but also to give you more of a heart-shaped look to your face because the muscles will atrophy after time when they're not being used. So I compare it to somebody who has their arm in a cast for 6 months. So when your arm's in that cast, that muscle is not being utilized. When you take the cast off, your arm is super skinny because those muscles have atrophied from disuse. The same thing happens when you inject muscles with Botox. Over time, those muscles will atrophy, and that's what contributes to the slimming of the face. So hopefully that answers your question a little bit, Haley. But they both have the same result. They're just a little bit different in price and how many units I've got to use of each one. Does anybody else have any questions? I'll be happy to answer. You're welcome. I did just read a research study on Botox for the jawline. So there's a different points of injection. So Botox was recently approved for the platysmal bands here in the jaw to help straighten or to help tighten up the jawline. So like when you strain like that, you can treat these muscles here. The platysmal muscle it's kind of like a sheet of muscle that overlaps right here, and it overlaps just below or around the top of the mandible. So that muscle is a depressor muscle, meaning it's pulling. So when we do Botox right along the jawline here and here, we are relaxing that muscle right there. And so it helps to kind of suck that muscle up and give you a sharper jawline. So in addition to that, what they found is by injecting right around the jawline here, so like 2 points here, 2 points here, and then about 3 points here, and then right where this platysmal band comes down on most people, you inject about 3 more points that way. Is it's sharpening up back here the jawline and helping with some of these jowls that we're getting. So that was something I just recently read, and I've tried it on a couple people so far with pretty good results. So we're always learning. There's always new things to do. So if you guys ever have a question on something that you think might be crazy, feel free to ask because chances are there's something I can do for it. All right. Anybody else? Anybody else? Going once? Let's see. Let me see if I can see. I can't see who's watching on Facebook. So usually what I do with the lives is when I'm kind of wrapping things up, I will pick a winner from somebody that is currently watching live. And Livia. Hi, Livia. From somebody that's watching live and give them some sort of free treatment or discount. So, out of everybody here today, Oh, we got another one. Hello. So Deb. So today let's do a sort of free treatment. What do you think, babe? Do you have any ideas? A free treatment? Oh yeah, let's do some peptides. So there are a couple peptides. I'll leave it up to you. So we'll do 1 week of peptide treatments for free. So I'll leave it up to the winner to decide based upon what your issues are. So if you're having joint pains or whatever, those kinds of things, I'll give you the peptides that help with that. If you're having sleep issues, falling asleep, staying asleep, I can give you a peptide for that. If you're having energy issues, I can give you a peptide for that. Muscle building or fat burning ones, I can give you a peptide for that. So I'll just pick somebody and then you let me know kind of what your issues are and we'll talk about the treatment that is best for you. And you can try that out for a week. If you don't have anything that's kind of bothering you, then we can do a peptide that is just overall good for you, that helps with like cell repair, helps cells realize that they're too old and they need to die, so that pre-programmed cell death, and then helps new cells be replicated that are healthier than they ordinarily would be. Just as we age, the new cells we produce aren't as healthy as the cells we made when we were younger. So these peptides help to kind of regenerate that cell on a mitochondrial level to make healthier cells, if that makes sense. Here, babe, come pick somebody. Make my lovely husband pick.
Lovely.
All right. So, DEP 825-2022. That's the winner. 1 week peptides. So if you would like to DM me, you could. You can also text me at the number I stated earlier, which is 772-207-0080. And I can have a conversation with you via text message about which ones you think would work best for you. Or you can DM me on Instagram or Facebook, one of those things. Or you can just call me and I'll be happy to discuss that with you. So after all that, if nobody else has any questions, then I will let you guys get back to your Monday evening. Hope you all had a happy Easter and got to spend it with some family and friends and celebrate. So, last chance. Any questions? Going once, going twice. All right, guys. I will see you next Monday. Have a happy and healthy week. And again, feel free to call or text with any questions. I'll be happy to speak with you about anything. Take care, guys.